Hello dear patients, today I would like to review the case of Celandine use. A woman came to us and in her papilloma or soft fibroma as it's correctly called increased in sizes after suntan. She decided not to go to the doctors, thinking that doctors don't know anything. She decided to remove it on her own by Celandine. She bought this magic medication, she did everything according to instruction, and as a result of that, papilloma got red and started to hurt. After 3 days have gone, and as papilloma was still hurting, she decided to add Celandine, as she thought that there are no other options. So she added Celandine again, and in 2 days, papilloma started to shoot, and pus appeared from under it. It got red and twisted. The pus started to exit, and it got clear that you cannot always use Celandine and other stuff. Not the patient should do the removal at home, but the doctor should do it. So the patient came with such neoplasm, and if edges are pressed, pus started to get out. Purulent process by type of abscess started. Papillomas removed with histological study, and it all ended very quickly. Couple of minutes of anesthesia by local lidocaine solution and by removal using radiowave method with subsequent histology. This all could be avoided, of course, pus and other things, if the patient didn't think of herself as a doctor and wouldn't do what she wanted by Celandine. If you do something by Celandine or other medications, if something unknown is going on, then you shouldn't add more and more of this solution, pretending that you are a doctor. You should come to any medical facility that is doing removals, and you would get a normal removal. Otherwise, you can get oncology. It can get purulent, and there may be a lot of other complications that would appear after self-made removal of papillomas. This doesn't mean that all lesions cannot be removed on your own, but if you are experienced in that matters, and I doubt it, if you are a qualified doctor, then you can remove papillomas by Celandine and other medications. If not, then go to cosmetology office. It can be removed by strings, which is even worse, but that's a separate story. So try to go to some free medical facility, like dermatovenerologic dispensary, or to a paid one, where removal is done. Removal of any neoplasms should be done with histology and with preliminary observation. If you think that this is papilloma, it's not the fact that this is true. Even my teacher, professor, told me that he did an error once and took melanoma as a usual papilloma. So such cases can happen even in professor's practice, not speaking about the people who remove what they want at home themselves. So I won't recommend removal, the more so as today this industry is quite developed. Different methods of removal are used. Try going to the institutions that have all possible methods available. These are lasers, fashionable today, radiowave method, liquid nitrogen, electrocoagulation, when the doctors choose himself with which to remove. This is different from when you have an ampule of Celandine at home and you use it hoping for miracle. If it is necessary to diagnose and remove different neoplasms, you can consult dermatologists and dermato-oncologists of our paid medical center of dermatovenerologic dispensary in Moscow. We have experienced doctors who do diagnostics and removal of neoplasms. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.